Those are our numbers for today. So back to the
Can I ask you a question
yes.
on the deaths? I've been asked about the clarification of what is considered a COVID-19 death. Um, if someone commits suicide, but they tested positive for COVID-19, it's still considered a COVID-19 death? Or if someone's tested positive for COVID-19 and the flu, is it still COVID-19 death? Or is it someone who's had congenital heart disease for a very long time and they were unfortunate to get COVID-19? It's still considered a COVID-19 death. Who decides what's considered a death or not? As it relates to COVID-19?
Yeah, it's a good question. We get that question a lot. We, local health departments are under strict guidance from CDC and the California Department of Public Health on classifying these deaths, and they're verified. What we report to the state reviews the numbers, and they then report those numbers for the statewide reporting. And so people obviously can die of and have multiple comorbidities, multiple underlying health conditions that led to their death. But if that death, that person that died was positive for COVID, that is counted as a COVID-related death. That doesn't mean that that's the only reason why they died, but they were positive for COVID when they died. And so that is the count. And so that doesn't mean that that person didn't have another health condition, but they were confirmed as positive for COVID. And again, this is in accordance with state and federal guidelines.
And so the other question I get a lot of is our death rate currently in the county more or less than it was last year? And I know you don't have that data, but maybe at some other time it would be good for us to understand that because those are questions our community has.
Yeah, so I can get some more data in terms of what deaths we had up to this point last year, but I know that our almost 20 deaths that we've had for COVID is higher than our average annual for flu.
Thank you. It's just information that I'm not sure what we're doing with it, but it's just good information statistically. I feel it gives us reassurance that we're doing the right things.
Yeah.
One death is more than we want,